Today I would like to introduce you to the use of the Shun-Thros peripheral microcatheter product. This is the product packed in a sterilization bag, this is the sterilization mark, and this is the label of the product. After unpacking, we can see the accessory pouch on the left, which contains the syringe, Y valve, and plastic needle. On the right, we have the cannula and peripheral microcatheter. This has an internal diameter of 0.022 inches, 0.56 millimeters, and a tip that closes to 0.019 inches, 0.48 millimeters. 3 millimeters tip, ETFE inner layer for low coefficient of friction, 3-stage segmented outer layer with tubing that softens sequentially from proximal to distal end. 3 developing rings, 10 millimeters spacing between developing rings. The distal exterior is covered with a 700 millimeters hydrophilic coating to reduce friction with the vessel. Before use, we soak the microcatheter in saline for 1 to 2 minutes afterwards. The lumen of the microcatheter is flushed with saline in a syringe and the air in the lumen is drained by continuous water discharge. Push the normal guide wire into the peripheral microcatheter. Then push the combined guide wire with the catheter into the guiding catheter and push the catheter to the designated position. The peripheral catheter can be guided during pushing by changing the direction of rotation of the guide wire and moving it backwards and then forwards. The combined peripheral catheter and guide wire are pushed into the guiding catheter just before reaching the location of the lesion. At this point, we withdraw the normal peripheral microcatheter and push the more penetrating peripheral guide wire, Shun-Thros, along the peripheral microcatheter. The combination of microcatheter and guide wire is then used to penetrate the CTO lesion by pushing and rotating, taking care not to keep rotating in one direction but to rotate from side to side, and to remove tension before continuing to push if you encounter difficulties. This is an introduction to the use of the Shun-Thros peripheral microcatheter. Thank you for watching.